Hey everybody, Dr. Donnelly Wilkes here, Wellness Wednesday. Okay, today I want to circle back on a topic I brought up last week regarding therapeutic options for COVID. So specifically, these are treatments for patients who get COVID that have typically been available from pharmacies, hospitals, and emergency rooms that now I've been able to obtain in the office. Public health departments are working with primary care and other doctors to get these products available from doctors' offices for better access to patients. Now, specifically, one that has been underutilized is called Evusheld. This is a double monoclonal antibody treatment given by intramuscular injection every 6 months. And this product is given to patients when they are not sick with COVID. So the group of patients typically are those who are immunocompromised for different reasons, either medical conditions or drugs that they take, or have been unable to receive the vaccine, have had adverse reactions or allergic reactions to the vaccine, or not expected to mount an adequate immune response from the vaccine. So let's take this puppy out of the box, demystify things. This is the drug. It comes in these two vials. And again, this is given about every 6 months by intramuscular injection. Some of the stats here, the reason why this is important is of the roughly 7 million eligible patients for this drug, only a small fraction have received it. To give you some examples, immunocompromised patients disproportionately represent hospitalizations and deaths. About 12% of all hospitalizations are immunocompromised patients, despite that percentage only being 3% in the United States. So disproportionate hospitalizations. So let's talk a little bit about, and I made some notes here, who these immunocompromised patients are, who's eligible for this drug. And if you know someone or you are someone, talk to your doctor. Send this information out. So, for example, those receiving active treatment for solid tumors or blood malignancies, blood cancers, those who've had a solid organ transplant and receiving immunosuppressive treatment, those who've had blood stem cell transplants within 2 years, those who have a primary immunodeficiency syndrome. Examples would be DeGeorge syndrome or Wiskott-Aldrich syndrome. There's others out there. Those who have advanced HIV or untreated HIV. And then a big group that I want to touch on are those receiving certain medications. So high-dose corticosteroids render you immunocompromised or can. And then a whole host of other drugs. Examples are alkylating agents, antimetabolites, tumor necrosis, blockers. These are big words, but your doctor can guide you and help you understand if your drug fits in that category of possibly immunosuppressing your immune system's ability to fight off an infection. And then another big category are biologic agents. What are these? They are drugs, medications, that are made from living cells. And so because of that, they tend to be more complex. They typically are given by infusion or injection, and they can have a degree of side effects that can render someone more susceptible to certain infections, including coronavirus. So examples of those drugs, there's a lot of them. You may have heard of some of them. Enbrel, Remicade, Herceptin, Avastin, Humira. And they treat a number of conditions that you may have heard of, like ulcerative colitis, Crohn's disease, ankylosing spondylitis, psoriasis, and psoriatic arthritis. So those disease processes and their drugs can make someone immunosuppressed and at higher risk for coronavirus. So remember, Evusheld, monoclonal antibody, it works because when you inject it intramuscular, it stays in the bloodstream for about 6 months. So if a patient is infected with coronavirus, it attacks that spike protein and prevents it from entering your human cells. All right, if this is helpful, pass it along. If you like it, follow me, send it to someone who you think might benefit. Best wishes.